Good afternoon, everyone. My name is Ansela Nombeu. I'm your host for this afternoon's webinar. Today, we're going to be talking about something very interesting. I know that everyone who's here is very passionate about this subject. We're talking about health and well-being. And this is because we always talk about green buildings, but we don't always talk about how we build healthy buildings. And I know that with the pandemic and everything that has been happening around the world, especially this year, we spend more and more time at home. Studies show that about 90% of our time is actually spent indoors. But what kind of buildings are we in when we're living those lives? So today we're going to be diving into those particular conversations and understanding from experts in the field how we can build better buildings. So a few housekeeping rules before we start. Please make sure that if you've got any questions, you can put them on the text box. We'll be following the questions closely, and the panelists will be able to answer your questions as we go along. We'll be looking at those. Please keep them in mind so that that can happen. And going to have a lot of speakers from across the continent and in various places in the world. Please make sure that you can look them up if you want to reach out to them and see if they can answer some questions that might not be answered this afternoon. So we'll have a hashtag because this is a webinar. We're using Twitter and Instagram, Facebook, LinkedIn, whatever social media platform you're on. Please make sure that you use the hashtag Better Places for People. That's hashtag Better Places for People. That's the hashtag that we are going to be using this afternoon. So now I am going to introduce the first speaker that we have, who is going to tell us more about the health and well-being framework, which is the Africa regional launch that we're doing today. And it is Christina Gamboa, who is the CEO of the World Green Building Council. Christina?
Thank you, Ansela. Hello, everyone. We're really excited to have you today in this webinar where we're launching the Health and Wellbeing Framework from WorldGBC. I am Christina Gamboa. I'm the CEO of the World Green Building Council, and I am very pleased to be here, and I'm very thankful to all the leaders on the shoulders of whom I stand here. I'm originally from Colombia and very proud to be serving this amazing sustainability movement in the built environment. Sorry about that. Okay, here we go. So WorldGBC, the World Green Building Council, is a network that catalyzes the uptake of sustainable buildings for everyone, everywhere. So we're up to a task that involves transforming a sector, buildings and construction. And we do that across 3 strategic areas: climate action, resources and circularity, and health and well-being, the topic we're covering today. We describe ourselves as a global action network, and we are very proud to have members in around 70 countries with whom we collaborate and align to move forward this ambitious vision. And additionally, these levers or change or enablers that we have at WorldGBC are very powerful ones. First and foremost, we're organized. Our members are organized in regional networks where we collaborate to implement and accelerate the change we know is the vision of the possible, and we advance further, faster together. Of course, we also do advocacy. We also know that it's beyond sometimes the individual impact that each one of us can have. And we call on governments also to take on ambitious policy that can enable and unlock the right policy signals, so there are the right ambition loops for the transformation to be deep and for sustainability to be embedded to really improve the quality of infrastructure and our quality of lives worldwide. We have partnerships with around 60 organizations that also have a profound sense of what needs to be done, and we are aligned in the same thinking. And of course, the leaders around our network, and today we have several in this call, which in their green building councils locally advance, let's say, radical business models that change and make this sustainability movement a reality. We recently approved this strategy, this holistic sustainability strategy to drive forward change. And I'm really excited because it's the first time where we did a global consultation, and a lot of stakeholders beyond our network participated too. And we were able to align on what needs to be done in the next years for sustainability to become mainstream in a sector that is responsible for 39% of energy-related emissions. So first and foremost, of course, climate action involves climate change mitigation, adaptation, resiliency, but we are listening to the climate science, and we know that we need to decarbonize the sector the latest by 2050. It has to become mainstream by 2050. So with our network and our GBCs, we accelerate action, and we have a very nice initiative called Advancing Net Zero that is furthering this whole life approach for buildings. And below, you can see also how we built the strategy in relation to the Sustainable Development Goals. For resources and circularity, we also have a vision, and we believe strongly that we have to aim for a regenerative world. The time is done where we have done incremental change or less damage. We're in a phase where we need restorative change, and we're aiming for regeneration in the decades to come so we can address the climate emergency and eventually also do our part in terms of avoiding further loss of biodiversity. And of course, health and well-being, which is the topic of today. And we're going to go deep in what it means for us today to address this topic in the world we live in and why we feel it's so relevant to connect and grow the potential of this framework to address the challenges we face in the years to come. So in that strategy and that framework, in that strategy, we have a vision for health and well-being in the built environment. And we want to act to make the built environment delivering healthy, equitable, and resilient buildings, communities, and cities. And to start that conversation, we have launched this framework that we're going to go deeper in today, which sets out the principles for this sustainable built environment from a health and well-being lens, if you like. There are several changes here in emphasis and urgency. Maybe in the past, our green building movement is now sustainable building movement, addressing the built environment. And we're going beyond just addressing how are occupiers and buildings impacted by the quality of infrastructure. And we're asking also that it creates social value and we address the rights of the human rights in relation to health, and also address, for example, the conditions of workers, of all the people related to the built environment, not only the ones that are occupying, for example, offices or homes. That is important because there's a lot of opportunity here to embed the social aspect here in a way that is more meaningful than in the past. And of course, my colleague and the author of this framework, Katrina Brady, is going to go into the topics that you see here of the principles and explain further why we believe this issue is so important for the times we're living. I would like to thank very much Mohammed Asfour and the Africa Regional Network for organizing this event, as well as the GBCs from Africa region who have co-created this framework alongside with the GBCs and the Better Places for People Steering Committee. Today, I am really excited to hear the analysis of this broad scope for health and well-being in the African context, and greatly looking forward to hearing from our esteemed speakers and WorldGBC partners who are demonstrating their leadership around health and well-being in the built environment. So with that, I would like to hand it over to Mohammed to tell us more about the opportunities and the challenges for Africa, who will be followed with the different speakers today in the very able hands of Ancillary, who will be hosting and facilitating this conversation. So thank you very much. And I hope we continue the conversation to make all this vision a reality.
Thank you very much, Christina, for that. That was very insightful. I think the main points that you raised there that I would like everyone watching and following the conversation right now to keep in mind are that the industry itself is responsible for 39% of energy-related CO2 emissions. That's a lot. It means that there is ways in which we can take all of this down. So I look forward to hearing more about how this can happen from the speakers that we have today. And I think another main point that Christina mentioned is about the holistic sustainability approach. So we're going to be hearing about that more. As Christina had already alluded, our next speaker is going to be Mohammed. Mohammed?
So greetings from the northern tip of the Great Rift Valley. Greetings from here, from Oman. This year, the entire human population has been inexorably spurred into paying closer attention to matters of healthcare. Regardless of industry, vocation, socioeconomic status, nationality, gender, ethnicity, race, or any other critical factor that tends to divide humankind, we are all united in a global fight to manage the COVID-19 pandemic. We are all actively and simultaneously working towards improving our state of health and well-being. I encourage us all to strategize on how the built environment can improve and support better health for people, animals, plants, and the environment as a whole. Jean Gang motivates us and says that through architecture, we can do much more than creating buildings. We can reduce the stress in our urban habitats. As humans evolve, so does their habitat. We have impressively progressed into building complex structures and spaces for ourselves, from exceedingly high skyscrapers to habitats immersed underwater. UN Habitat observes that sub-Saharan Africa is urbanizing faster than any other continent. The United Nations expects that by 2050, 68% of the world's population will be living in urban areas. However, there have been increasingly worrisome effects of these concrete jungles on our humankind and the earth we live in. One of them being that these spaces trigger and cause diseases, both communicable and non-communicable. Africa as a continent stands as the second largest spatially and the second most populous continent in the world, with about 1.2 billion people. This is a tremendous powerhouse that can be tapped into collectively towards a healthier relationship between the people, the built, and the natural environments. Let us analyze the state of health in the Africa region through a snippet of recent statistics as follows. The World Health Organization warns us of severe strains on African health systems imposed by the high burden of life-threatening communicable diseases, coupled with increasing rates of non-communicable diseases. The built environment and construction industry directly impact public health in various ways. Let us zero in on infectious diseases and air quality. Urban areas tend to be plagued with epidemics of infectious diseases. In Africa, the spread of infections is further fueled by limited access to proper shelter, safe sanitation, and clean water. In the 21st century, there have been many infectious diseases that have emerged and re-emerged in Africa, with about 50% of all deaths being caused by infectious diseases. I urge you all to modify your building life cycle to promote healthier lifestyles that reduce the risk of transmitting infectious diseases. Another direct link between the built environment and human health and well-being involves the quality of the air we breathe. According to the WHO Global Ambient Air Quality Database in 2018, 97% of cities in low and middle income countries with more than 100,000 inhabitants do not meet WHO air quality guidelines. Moreover, the emission of pollutants into the air negatively impacts climate change. In fact, between 2030 and 2050, climate change is expected to cause approximately 250,000 additional deaths per year, with the total consequential damage health costs to be incurred estimated at $2.4 billion per year by 2030. The construction sector is a significant contributor to air pollution throughout the various stages of the building life cycle, from production and sourcing of materials to furnishing spaces. About 39% of global energy related to carbon emissions are being released from buildings and construction only, with operational emissions accounting for 28% and 11% coming from embodied carbon. Excessive air pollution is one of the dangerous outcomes of modern industrialization, which kills an estimated 7 billion people worldwide every year. Economically, the IMF projects that economic activity in sub-Saharan Africa will contract by 3.2% in the 2020-2021 period. As a continent, Africa is not only battling a health crisis compounded with the ongoing global pandemic, but also an economic crisis, one that in just a few months has jeopardized years of hard-won development gains and upended the lives and livelihoods of millions. The building sector can help alleviate both the health and economic pain in various ways. One of the cornerstone channels is by advancing net zero and creating sustainable, healthier, and equitable buildings for all. During the global launch, Dr. Joseph Allen reminded us that healthy building drives human health, which drives business health. Despite the current disheartening state of health and the ominous projections on harmful outcomes, if we continue living and building as we are, we hope to transform the building industry. Christina Gamboa reminded us that through a systems change approach, we are leading this shift towards net zero carbon, healthy, equitable, and resilient built environment. Each one of us can play a crucial role in changing and reinforcing the construction sector for holistically nourishing spaces. They are intrinsically tied together. If you are being healthy and well, you are being more sustainable. Therefore, we welcome your engagement with us in today's event and in the 2020 WorldGBC Health and Wellbeing Framework. Commendably, we must acknowledge the great progress the African population living on the continent has made at managing various public health crises and improving health systems to curb various disease menaces. I'm confident that as the building sector in Africa, we can further scale up these efforts. Emma Miloyo, who was the first woman to qualify as an architect in Kenya, profoundly proclaims that to realize architecture, you have to have a lot of emotional intelligence. You realize that it is a lot about that it is a lot about drawing, but in fact, the major part of it is how you interact with people. Let us build with people in mind. Let us build for healthier relationships. Let us build for better health and well-being for all. Let us build for a healthier and a prosperous Africa. Angela.
Thank you so much, Mohammed, for that very insightful talk. I think that one of the things that really caught my attention as you were speaking is that we need to build with people in mind. So all of this is about building with people in mind. That's why our hashtag for this afternoon is better places for people. That's what this is about. Another thing that you also mentioned that Christina had also alluded to is that the building life cycle should be improved for our well-being at all times. I mean, you gave us really interesting statistics. One of them was that by 2030 and 2050, between 2030 and 2050 rather, climate change will affect billions of people around the world, contributing about 250,000 more deaths every year. That's a huge number. It means that the construction and engineering industry has a role to play to ensure that our buildings are better and safer. Right now, we are going to now hear from Lisa Reynolds, who is the chair of Africa Regional Network World Green Building Council. Lisa?
Thank you, Angela. So I would officially like to say greetings, everybody, and welcome to the launch of the World Green Building Council Health and Wellbeing Framework in the Africa region. As Angela said, I'm the chair of the African Regional Network of the Green Building Councils, and I'm CEO of the Green Building Council of South Africa. So on behalf of the Green Building Councils of Africa, I welcome you. I would also like to extend a special welcome to Christina as the CEO of the World Green Building Council and our intrepid leader. Welcome to all my fellow heads of green building councils and societies across Africa. So all I have to say in a nutshell is this is not a perfect time in the world to launch a health and well-being framework. Is it not perfect timing? You know, I was listening to Christina, Angela, and even Mohammed, and you know, in my time, I've done quite a few presentations, quite a few welcomes, and as I'm sure many of you have, and people listening to you always pick up that you have a few favorite words that constantly come up when you speak. One of my favorite words is holistic, and it was quite surprising when I heard Christina say it, Angela said it, and you know, my latest favorite words are green recovery, and regeneration, and regenerative. These are the favorites. So if we look at holistic, it covers the approach that was taken by the teams who drafted and developed this amazing framework. Holistic covers the approach that it takes when we look at sustainability, when we look at greening, we look at all the positive effects that accompany it. We have to take this holistic approach. Green recovery and regenerative are such healing words which we need in a world that is healing. So even though we know that our recovery has been a bit up and down, and I know in Europe a lot of people have got back into lockdown, and so recovery has probably been more difficult than we anticipated. But when we look at green recovery, regenerative, this framework links all of these together. And I found that there were a number of lessons that we all learned during and still learning during this COVID-19 pandemic and the lockdowns that we have to experience throughout the world. And the first lesson that I saw was that while we were away in lockdown, the earth recovered. There has, I don't think in my time, and I've been around the world for quite a while, you can tell by the grey hair, in my time, there has never been such a visible proof of the impact that humans have on the earth as when we were in lockdown. When we were not out and about and conducting our business as usual, sky was clearer, and the air was definitely cleaner. So we could see a living example of the impact that people have in their normal dealings on the environment. And I said, you know, even those who have an ostrich head in the sand approach to climate change and the impact of carbon emissions couldn't deny the change in the world that we saw around us. And just to let you know, in real life, ostriches don't bury their heads in the sand. Like all good Africans, they like to see what's coming. And what we'd like to see that's coming is the green recovery. The other lesson that I learned during COVID is that COVID, like many diseases, and Mohammed touched on Africa and the struggle with diseases, is that COVID, pandemics, they have no respect for countries' borders. You know, it brought home to us that borders are man-made, and that in a world of no borders, we have to find solutions together. And I believe that this health and well-being framework is a solution that has no borders. It is the result of people throughout the world sitting together and establishing, again, a holistic approach encompassing sustainability to health and well-being. And you'll see by the slide that Christina showed that it is a solution for all. It takes in the social well-being. And she said to me once, and Christina, it really stuck, that sustainability is for all, it must be for all. And I think that this document, and I hate to name it a document, so this guide encompasses that philosophy too, that it is sustainability for all, it's health and well-being for all. However, this will be a document if it sits on your virtual shelf. So I encourage everyone to read it, embrace it, and implement it. So officially from the African Regional Network, I thank you for this opportunity to speak and welcome you all, and I look forward to the presentations of all the experts going forward. So, Angela, I hand back to you.
Thank you so very much, Lisa, for that. Again, we keep on going back to the same type of words, like you said, better places for people, a holistic approach. I like that you made a comparison of this framework and what it aims to do to the pandemic, that it has no borders, so it can be applied to various places across the world. And you also touched on a new word that I know that we're going to be hearing a lot today, talking about green recovery and us wanting to see how we can go towards that. Up next, we've got Katrina Brady, who is the head of Better Places for People and Strategic Planning Lead, World Green Building Council. Katrina?
Thank you, Ancila, and hi everyone. It's an absolute pleasure to be here with you today. My name is Katrina Brady. As Ancila kindly introduced, I'm head of Better Places for People and the Strategic Planning Lead at the World Green Building Council. Thank you, Christina. Thank you, Mohammed. Thank you, Lisa, for your opening remarks. And I'm going to be now taking you through the health and well-being framework that myself and the Better Places for People Steering Committee have worked on for 2 years to get to this point that we're here at today, launching it across Africa and across the whole world. Okay, so Christina has showed us this framework already. I hope you have liked it, absorbed it. You can see our 6 principles for the built environment looking across the life cycle. And it's my pleasure to take you through these in a little bit more detail. In the 10 minutes I have just now, I'm going to begin with a little bit of background of why we chose to redefine health and well-being, why our network gave us this feedback that we needed to do this work. Then I'll take you through what the framework can be used, following up on what Lisa said in her opening remarks, and then take you through the principles themselves, how they can be used, the outcomes for the sector, and the calls to action that we want to leave you with today. So looking backwards first, why is the World Green Building Council updating health and wellbeing principles? And Lisa said it very eloquently just prior to me now, and I'm pleased to use one of her favorite words, that over the last few years, we have recognized this shift in how we're talking about buildings. We're moving away from talking just about green buildings to talking about sustainability and a holistic approach to sustainability. Lisa, I agree with you. I'm using the word holistic all the time now, and I love it. And one of the trends that we've recognized at the World Green Building Council, as Christina said, our members are across 70 nations, representing 36,000 organizations, that as the Sustainable Development Goals have risen in prominence across all industries, across public and private sector, that there has been this awareness and this increasing recognition of the fact that sustainability in every sector has to cover social, economic, and environmental indicators. And for health and well-being, we want it to do exactly the same. So we recognise, based on the feedback of the Green Building Councils, and actually a very important piece of feedback came from the Green Building Council of South Africa's representative on our steering committee 2 years ago. So a wonderful end to this circular story here, but that we needed to be reflecting this holistic approach to sustainability within our work on health and well-being as well. So taking that, we wanted to create a tool that was global, something that we could provide to people, a document, a resource, a guide that would equip a global audience with this high-level information for education, training, advocacy, and also to create a stepping stone for certification that ensures the impact of the built environment on human health at all stages of the life cycle is recognized and understood. One of the biggest outcomes of the consultation that we led with the steering committee and with major private sector leaders in this space, the sponsors we were pleased to work with, and also major international leaders, including the World Health Organization and the United Nations, was that health and well-being in our sector has for too long focused only on the building occupant. And at the moment, of course, our context of being amidst a global pandemic, this couldn't be more relevant. And we're all very acutely aware, aren't we, of our own indoor environmental quality and how it impacts our own mental and physical health. But what this consultation has showed us is that we must consider all people at all stages of the building and construction life cycle, whether that's people who are living around you in your community, who are coming in and out of the same building as you, but you might never meet, whether it's people who are working in the construction industry or sourcing the materials that make the very building blocks of the buildings and cities that we walk around in, or even the people who we may never meet but are impacted by the emissions and the pollutants that come from our buildings and construction sector, and people who are impacted by those on the other side of the world. And that, I think, is reflected in this conversation of equity. Christina mentioned it, Mohammed mentioned it, Lisa mentioned it. We're hearing it from all areas of our network that across all areas of sustainability, we must consider equity in how we tackle climate change, in how we equitably use and divide a finite number of resources, but also with health, that we must take an equitable approach for health and have a building and construction sector that prioritizes creating healthy spaces and places for people all over the world, for everyone, everywhere. So now I'm going to go into what is the framework, how it can be used, before I take us into our 6 principles. The framework is a set of comprehensive global guidelines. It's available online. You can see the link down there on my slide at worldgbc.org/health-framework. And the principles are set to take a whole life cycle approach to health and well-being in the built environment. It's available in 2 formats. Firstly, the full version of the framework is a full digital resource. This is available at the link that I just said. And each one of the principles and the sub-principles that sits underneath it has a research summary, an outcome, benchmarks, strategies divided up into different stages of the life cycle, and a resource list that was compiled through an open consultation with our network. So that full digital resource is lengthy. It has a lot of information there. It's divided up so it's easy to find the information that you're looking for, but it is around 20,000 words worth of content. So if you're looking for something a little lighter touch to introduce you to this content, I would encourage you to look at the executive report, which is a much shorter summary. It's more visual, and it's currently being worked on by a number of our green building councils around the world to have it translated and shareable for a global audience. And in terms of how the framework will be used, because we are at the World Green Building Council working to equip our members with the resources they need, we needed this framework to be suitably high level and flexible, that different green building councils and their members could use it in different ways. So the framework, the report, the principles within it, the full resource can be used for communications. You'll see some of the communications material available in these slides. There are many, many more. It can be used as a design checklist for a design stage analysis, or even for operational buildings and organizations. The information within may be able to enhance existing certifications, and also it helps us to promote and act as a stepping stone to certification by giving people an introduction into health and sustainability into the built environment, which they can then take that next step and look to a certification to get that third-party performance measurement for their building or portfolio. And then, of course, it acts as an education resource. We'll be supporting the Green Building Councils and our partners in the industry in the coming years to create resources, thought leadership materials, training materials to support this, and also, of course, for advocacy. We know a number of our GBCs work closely with regional or national policymakers, and the framework can be a great way to analyse against your building and construction policies, your building codes, urban planning policies, to see if there are gaps in any of these areas that relate to health and well-being. So what are these areas? Let me tell you now the 6 principles of our health and well-being framework. So looking at the graphic on the right, these are protect health, prioritize comfort, design with harmony with nature, facilitation of healthy behaviors, the creation of social value, and taking climate action. That's our high-level way to summarize it. But there is, of course, a lot more information sitting underneath each one of those principles. So, for example, under Protect Health, through the consultation that we ran, through the methodology that we used to gather this information, we established sub-principles that sit underneath each one. So for Protect Health, that covers air quality, indoor and outdoor, covering everything from our exposure to ambient pollution, as Mohammed was talking about, to indoor pollutants, whether they're biological or chemical, or coming from lack of ventilation, or even coming from infectious disease, very relevant at the moment, and covering both our physical health and our mental health. In terms of comfort, this covers indicators of comfort of all types, whether it's thermal, acoustic, lighting, ergonomic, accessibility, inclusive design. Harmony with nature, incredibly important and very topical. This is considering indoor and outdoor. When we're talking indoor, it could be biophilic design, our intrinsic connection with nature, and the fact it's beneficial to our mental and our physical health to be in indoor spaces where we have that connection with nature. We want that outdoors as well. We want that biodiversity, the increasing access to different breeds of flora and fauna, and also using nature-based solutions as a priority where we can. The facilitation of healthy behaviour was a topic that we discussed at great length, and the areas that sit underneath that are active design, the way that you can use design at building or master plan level to encourage people to live more active lifestyles and to subconsciously influence behaviour choices that you might make around wider lifestyle factors, including nutrition and hydration, and even social connectivity through conscious building design. Then the next 2 are the areas that I feel most passionate about, and the areas that I'm so delighted that we're able to include in this framework. Creating positive social value really encompasses everything that we've said about not just looking at the occupants, but looking at all people in the life cycle. So social value is considering the human rights of construction workers and people in the supply chain, the mental and physical health of those workers, but also community health, social value, equity in the community, social resilience. And then from an environmental perspective, as Christina mentioned, we have a very advanced and sophisticated program focusing on reducing operational and embodied carbon emissions from the built environment. And within our Take Climate Action principle, we're able to take that guidance and present it through a health lens, looking at climate change mitigation, adaptation and resilience, and then how we're dealing with our resource crises all over the world. Water efficiency, particularly important in areas of Africa, I know, resource efficiency, material health, and the circular economy. So that is my very quick high-level overview of these areas, and in the coming session, I'll be talking to a series of panelists and deep diving into these principles and bringing in the audience as well for us to discuss these principles and their relevance for Africa in more detail. But for now, I want to leave you with some closing remarks. I think my slides have just frozen. Ghazi, if you wouldn't mind changing it for me, thank you. The outcomes for the sector and calls to action are as follows. Firstly, that human health, well-being and quality of life are impacted by social, environmental and economic determinants of health. As we can see in this graphic, when you map our principles against the Sustainable Development Goals, the overlap is huge. Secondly, that all people across the building life cycle should have their health protected and enhanced. We're looking at all actors across the value chain. We're looking at all elements of the life cycle, which I know is incredibly ambitious, but it's our job as a global network to champion this ambitious leadership and work with our network and our partners and all of you listening to be able to roll out these principles on the ground. So the call to action for the industry I leave you with is this, that we look to consider the health, well-being and quality of life of all people impacted by the building and construction sector at all stages of the life cycle. We can use this framework as one of the many tools to enhance awareness of how the sector can improve and positively impact health and well-being, working towards a sustainable and healthy built environment for everyone, everywhere. Thank you very much, and I'll hand back now to Ancillor.
Thank you very much, Katrina, for that insightful presentation. As she mentioned, we're going to have a panel discussion that's coming up soon, and it will take a deep dive into the 6 principles that she mentioned about protecting health, prioritizing comfort, harmony with nature, facilitating healthy behavior, creating social value, and taking climate action. However, before that, we're going to take just a 5-minute break. So if you'd like to take some water or think about your questions and write them down, please use this time to do so. And while we do that, we're going to leave you with a video, 3-minute video that has some interesting statistics and insights. Enjoy. Welcome back, everyone. I hope you had a nice water break. Now we're going to dive into the 6 principles that Katrina alluded to in the previous session. Please make sure that you do send your questions through to the tech chat box. We're seeing a lot of great questions that are going to be addressed during the section. Please don't forget to also use the hashtag Better Places for People. Katrina?
Thank you, Ancillor. Okay, and thank you everybody for staying with us. It's a pleasure to be back for session 2. I'm delighted to lead this next session where I will be joined by 4 distinguished speakers who are experts in the Africa region, whether they live there personally, whether it's expertise professionally. We've got a huge amount to share today. So this is an interactive conversation. As Ancillor just said, please do share your questions in the chat box. The team and I will be picking these up throughout. We'll try and weave in as many as we can into the conversation in the next 45 minutes. Please also join our conversation on social media using the hashtag Better Places for People on all social channels, and also be prepared to share your opinion in our interactive poll. So without any further ado, I'm delighted to introduce the 4 panelists who I have here with me today. So I'd like to welcome firstly Georgina Smith, who's Head of Technical at the Green Building Council of South Africa. Hi, Georgina. Secondly, we have Michael Ofosuheni-Wise, who's the Climate Policy Associate at the World Business Council for Sustainable Development, speaking to us today from Geneva. Thanks for joining us, Michael. Next, we have Dr. Beatrice Mirage, who is a medical doctor and a senior scientist at Philips, speaking to us from Nairobi today. Hi, Dr. Beatrice. Thanks for joining us. And last but not least, we have Andrew Jackson, who is the Commercial Director of Europe, Middle East and North Africa and Africa, I believe, of Shaw Contract. Hi, Andrew. Thanks for joining us today. Okay, so we have this set of distinguished panelists, and without any further ado, let's hear from them. So just a reminder to our audience, please share your questions in the chat box. And we're going to be taking a deeper dive and analysis into those health and wellbeing framework principles that I presented before the break. And first of all, let's hear an opening remark from each of our speakers. So I'm going to ask for an extended answer of a couple of minutes from each speaker, talking to us, giving us an overview about the framework in the African context. So as I've just shared, as we've just heard in session one, the framework is all about redefining the scope of health and well-being for the building and construction sector to consider the full life cycle of the sector and all the people impacted within it, and social, economic and environmental determinants of health. So we'd love to hear from you to start. Why is this important for this sector? And particularly, why is this important for Africa? Georgina, may we start with you, please?
Certainly. Thanks, Katrina. And good afternoon to everybody who's listening. And it's a good afternoon from the tip of Africa in Cape Town, South Africa. And thanks for the opportunity to share some of the perspectives from the GBCSA. So we obviously believe very strongly that health and well-being, particularly as it plays out in the construction and building industry, is vital for Africa's developmental agenda. The GBCSA has always prioritized health and well-being through our engagement on South African and African projects, which have been going on since about 2010, because of the Green Star tools having a very kind of broad-based, holistic approach to sustainability that considers indoor environmental quality, you know, things like good daylight and good thermal comfort. And you know, what I find really interesting about the framework, and I was, you know, sat on the steering committee and contributed to it as well, was the focus on how the role of the built environment impacts the social elements. And Katrina, you did mention them briefly, but I mean, this spans issues from human rights to the health of construction and supply chain workers, looking at occupant behaviors. It speaks to social justice and how that translates into community well-being, community resilience. And I think when you consider the African context and some of the issues that we are facing with regards to poverty, inequality, and social injustice, the framework has incredible value in that regard. We have to fundamentally protect human rights. We know that in the construction industry, in terms of the supply chain, the impacts of the materials that we need to source, often these are found in quite dangerous environments. And we know that a lot of these minerals and materials are sourced on, you know, on the African continent. We've got to consider issues of migrant workers and how they are kept safe in countries that are not their own. And then we need to consider issues of diversity. And we know that that's really important, both in the construction labor force, but also in the professional design space. We also need to look at the health and well-being of both the construction workers and the supply chain workers, because they really face very heightened physical and mental health risks. We're aware of that. And then the key thing, and this is something we've engaged with a lot of our members, is also the long-term impact that a building has on a community. So it's got a multiplier effect, and that can be a positive one, and particularly within an African context, we want that to be something that generates jobs, that you know, supports local economic development in the area. Sometimes, you know, projects can have negative impacts as well. They can contribute to segregating an income. You could have loss of culture. You could have an increase in crime. So we also want to mitigate against that. So it's really, I think from an African perspective, it's really great that this framework has this broadened and expanded scope and definition of health and well-being. And I think that that's really an incredible contribution for the continent. Thank you.
Thank you, Georgina. Great opening remarks. Michael, could we come to you next, please?
Thank you very much, Katrina. I hope you can hear me. Is that okay? Yes, so yes, thank you very much for the invitation to join this panel. Greetings from Geneva and good afternoon from here. And thanks for the question. I would like to basically say, following my review of the framework, I would like to begin by setting a little bit of context and understanding that, buildings in the built environment really forms our worldview. It represents our homes, our infrastructure around us, our churches, our offices. It employs a huge sector of the economy, and it has a huge impact on our life. And I think this framework, as it is now, is something that goes into basically giving a holistic overview of, and sorry if you used that word holistic that Lisa was mentioning earlier, but the framework is particularly important for the building sector for a variety of reasons, and I'll focus my interventions on three main reasons. The first one is about the awareness that this framework raises about the interconnectedness between our built environment, health, climate, and nature laws. In many cases, and you rightly mentioned, Katrina, that when we talk about the concept of health and well-being within the built environment, we limit the scope to the use phase of the building. You're looking mostly at the occupants and those within it. But I think this framework takes a holistic approach and basically looks at the full life cycle of the buildings. It looks at the design phase, the construction phase, the operation phase, and also looking at the end use phase and how we get rid of buildings, and incorporates all the implications of this not only on nature and biodiversity, but on climate change and society at large. So, for example, I think the impact on health, when we talk about indoor and air quality, we know that globally around 3.8 million premature deaths are attributed to household air pollution annually. In Africa, to focus on that, and other developing nations where we say that alternative sources of fuel can be scarce, exposure to particulate matter from some of these sources of fuel can be a great attribution to such health impacts. The second reason why I think this framework is really good for the sector and also for the African continent as a whole is that it provides an overview and guidance of clear specifications for the key stakeholders within the value chain. It gives clear recommendations for policymakers to set policy and initiatives, including building codes for energy sector, for sustainability standards, and inform policy change that protects and enhance the health of all people in the built environment. It also gives recommendations to the planners, to the architects, to the constructors, and all those stakeholders within the use phase of the buildings as well. I think in Mohammed's earlier remarks, he talked about the key trajectory that Africa is on, specifically when we look at global population growth trends and also things like urbanization. We are in a phase where the research is telling us that by 2050, the population of Africa is more than likely to double. We also know that a lot of the buildings that will actually need to inhabit these people are not yet built. So having a framework like this that looks at all the implications of health, societal issues, and the impact on nature and biodiversity is important to have that holistic approach before we start building those buildings. So putting all of that into perspective, I think the framework is actually a tool that we can use within the full value chain and make sure that all actors have the right framework to sort of collaborate in a radical way to build the future that we need. So on that note, I will just conclude by also mentioning exactly what Lisa said. This framework will be only useful if it ends up being implemented. We need practitioners to actually use them. We need the planners to build the checklists If it within their planning documents, you need the architects to design buildings within these frameworks that looks at all of these holistic ideas in place. We need to make sure that the systems come together to work for the good of all of us. And yeah, that is my call to action. That is my goal, that at the end of this session, all practitioners on this call and beyond will be able to use and leverage this framework in order to advance on health and well-being within the built environment sector.
Michael, thank you so much for those opening remarks, and great to get a call to action for everybody listening within our opening remarks of this session. So thanks for kicking us off there. And Beatrice, can we come to you next, please? Lovely to have you here. Would love to hear your opening remarks, please.
Thank you so much, Katrina, for having me on the panel for this particular launch. I think in terms of the opening remarks, I'd like to just probably reiterate what the Philips CEO mentioned about 2 months ago, when he was just releasing a statement, just just re-emphasizing the commitment of Philips to just doing business responsibly and sustainably, and just being able to highlight new things and new goals that we aspire to from an environmental, social, and governance point of view. And for the purpose of this discussion, I think it's mostly just highlight 2 of those things that fall within that particular docket. One of them is the Sustainable Sites initiative that Philips is working on. And when we talk about sustainable sites, we're looking at our manufacturing sites globally, Africa included, of course, and even our large office spaces and the places within which, let's say, Philips has responsibility of what happens therein. And one of the things, or rather 4 of the things that we really aspire to do in terms of just having more sustainable sites, we do appreciate it's not a silver bullet solution. It actually does require a lot of working together with other stakeholders, but looking at 4 main things. So one of those things is just being able to see how can we have better circular management of our materials. So just reiterating on our circular practices, the reuse, the recycle, the reducing of materials, and that's in the things that we do, and even in the products and services that we offer. The second bit is on the aspect of renewable energy. So that also ties into what does that mean in terms of how we build up our spaces. Another thing is in terms of just reducing our water use, and especially in high water risk areas. So of course, when we talk about water and water risk and access to clean and safe water, Africa does fall within that particular category. And then how do we create awareness and just bring stakeholders to the table that we can work together with, and just bring these particular goals to fruition? And this forum is one of those. The other thing is just the whole aspect of access to care, and especially for underserved populations. And Africa does fall within that aspect. And commitment of Philips is to actually just improve about almost 300 million lives by about 2025 within that particular category of populations. And in terms of just partnering with different stakeholders, again, to see how do we improve healthcare. So when we look at healthcare at Philips, we look at it as a wellness, and how we also help you manage your getting back to wellness, especially when you're sick. So it's a continuum of care that touches the home, it touches the healthcare facility, and just your entire journey when you're seeking care. So when I circle that communication back to what Mohammed, I think, and different speakers have highlighted today, that we're in the midst of a pandemic. So just given the social distancing, or what we call physical distancing measures, and just that whole restriction of movement, I think the chain effect is just seeing a big change in terms of the functionality of the kind of buildings that we have. So it's not very clear cut as it has been before, and there's need to factor that in, especially in the design of those buildings. If you're looking at people being mostly indoors or being confined, for lack of a better word, within certain spaces for caution's sake, then we need to think about things like mental health. I mean, if you're in the same space for a long time, and the whole conversation around your biophilic environments, how do you make it a bit safer even for mental health? And looking at, again, the pandemic, if you're putting different people within the same space. So traditionally, you take, let's say, an ill person to a hospital building, or a building just designated of patients. But we're looking at things like home care, especially for asymptomatic patients or mild, symptomatic patients. So if you're putting those kinds of people in the same space, what does your, let's say, your heating, your ventilation, your air conditioning, so those kinds of things from the design points of view, we have to start thinking about them differently. So from a pandemic, and even past the pandemic, because it will pass, just that change of how we work with functionality, something we need to start thinking about as a way of design moving forward. Then finally, when we talk about Africa and a lot of, let's say, emerging or developing contexts, there's still the fundamental discussion, I think, which we do work with partners, especially in the UN circles. In Africa, it's mostly within engagements with UN Habitat, in how we actually just increase the access to dignified shelter. We cannot go into the higher level discussions of what kind of ventilation or even, let's say, air conditioning you have if we've not solved the basics of dignified shelter. And if we do not have dignified shelter, then we're looking at healthcare being affected across the entire spectrum, whether you're old, whether you're young, and whether you're male or female for that matter. So it's just, it's interesting to just be able to put those aspects in mind as we start this particular session and as we unpack it going forward. Over to you,
Thank you,
Katrina.
Beatrice. Thank you. Loads of great points brought up there in your opening remarks. We will unpack them a little more as we go through. Thank you. And now, without any further ado, Andrew, would you like to share your opening thoughts as well, please?
Yes, firstly, thank you very much for letting me be a part of the panel today. I get the benefit of being the last person to reply to the question, so I agree with everything that a lot of you have said about answering the question. And it's funny because at the end of last year, Shaw Contract, who we are predominantly a manufacturer of commercial flooring globally, changed. We changed the way that we look upon our business, and our kind of smarter impact initiative, which really consists of 3 pillars, which is being knowledge-led, human-centric, and optimistic, came at a really crucial time for us and is totally reflected in this framework. I can remember I joined the construction industry and started working within this region back in 1998. And during that time, some of the key initiatives were health and safety. And I was thinking when I read the framework, just how different a definition we have of health and safety now in the terms of being more personal and more human across the construction industry, which is extraordinarily difficult to do in the most established regions of the global market. And so understanding some of the points from the framework, I've really split into really 2 areas, macro and micro. And the global change, the climate action, the positive social and community action, as well as the behavior and health actions, are all sometimes very difficult to visualize when you work day to day within a construction industry. And it doesn't matter what your role is, but it's always very difficult to understand those kind of foundations of the direction that you should be taking, whether you're designing a product or a space. And the other side of the other 3 areas which ring very true to our business and certainly our approach and our experience of our day-to-day construction industry is improving health and comfort and harmony with nature and design. So when I first started looking at this framework and trying to understand how all these different aspects could be functionally used, which I think is really important in construction, we have some very interesting ideas and we have some great teams, but my feeling is we don't always readily collaborate those and bring those to fruition very quickly. And when you look at those, you're trying to work out how local authorities or governments, end users, and how the design process, supply chain can actively just take maybe 1 element or 2 elements of this framework and actually put it into their day-to-day activity would be a significant step forward. And ideally then throughout the entire process of the construction industry, which is so, I believe, underplayed across the global economy, even though we represent quite a high percentage of GDP and activity and employment, it's so important to just get it functionally working at some level. I think the framework has done that in a fantastic way, and I think it applies and associates itself to any given market. So from our point of view, or certainly from where we are now, as normal, the World Green Building Council have done a great job in laying the foundations, and now we as a team, whatever role you have to collaborate and functionally make that happen, regardless of how challenging our environment is currently.
Thank you, Andrew. Great opening remarks, and thank you to yourself and the team at Shaw Contract for your support in this work over the last couple of years. Your expertise has been brilliant to have on board. Okay, so we've now heard from all of our speakers. We've had some interesting opening remarks, and I think we've got a lot to discuss in the next 20 minutes or so. So let's move into the Q&A portion now. I'll be asking for shorter responses from my panelists, and we'll bounce through each one. Now, the first question I want to bring in is taking us back to some of Lisa's remarks about our holistic approach to sustainability. And I think we can say that the most famous framework on sustainability, the UN's SDGs, the Sustainable Development Goals. Now, of course, we know that health and well-being is SDG 3. It's one of the 17 SDGs. And I want to ask our panelists to unpack a little more why it's so important for us to address health and well-being alongside the other 16 SDGs. Why don't we just prioritize health? And I'm going to ask that to the man who, like me, is wearing an SDG pin. Michael, can we start with you, please?
Thank you very much, Katrina. I think if we look at the state of the world right now, the science is very clear. We're getting signals from the IPCC on climate change. We're getting signs from IPBES on the state of biodiversity. We're getting very interesting science reports from the social side, from the nature side. But what we come to understand, and what the science is very clear to us, is that these are not isolated incidents anymore. What we're beginning to understand is that we do not have a health crisis only on COVID. We do not have a climate crisis. We do not have a biodiversity loss crisis. We do have an interconnected crisis. And the only way that we as a humanity, as people, are going to overcome these challenges if we start thinking about these systems and these challenges together. And I think that's why the SDGs have become such successful and such famous tools that everybody is trying to work with, because they provide that framework, that lens, to take a systems approach to how we take things from nature to produce, how we work with a circular economy, how we deal with health in a way that also benefits climate, that benefits biodiversity and nature. And by understanding these interconnectedness of most of these issues, we understand that taking health, for example, every year we know that over 7 million people are dead because of climate-related health risks. So taking climate action from a health perspective allows us to see the co-benefits, that while we can create solutions to solve this 7 million death issues yearly, we also have the added benefit or co-benefit of solving climate change in the process. And right now, there's a lot of conversations going on net zero, reaching net zero action by 2050, which is the broad goal that we are all working on in the climate space. But there is a lot of synergies with nature and biodiversity and all of these other 17 goals. And I think putting that framework in action is where we can see how we have win-win solutions for working on health, but also with all the other 16 SDGs.
Thanks, Michael. I don't think you could have put that any better. I love that phrase that you said. We don't have a health crisis, we don't have a climate crisis, we have an interconnected crisis. Do any of our other panelists want to come in on that?
Katrina, I think when we're thinking about sustainability and sustainable development, we really want to get to a state or a point where both people and planet thrive. And I think that's really the key. And healthy buildings really allow for this, because they obviously reduce the impact of toxins that go into the environment, either during the construction process or in operations. We know from various studies that they can assist with improving your cognitive function and your productivity, and that can translate into financial benefits. we've touched on the social impacts, that could be achieved. And obviously, we know now, with the highlight and the focus that COVID has put on buildings, they can actually be used as a tool to fight infectious diseases. So it's very clear that they are, that health is really an intrinsic part of sustainability. And maybe just to kind of share from, obviously from an African building perspective, most projects, consider health and well-being to be a really important part of their project deliverable, whether they pursue it through a rating or not. So, I think that there's a good understanding within the green building community, particularly from South Africa and the South African professionals and African counterparts that are working on these projects to really try and work with clients and educate them. So I think that that's really encouraging as well.
Thanks, Georgina. And I want to pick up on what you've talked about there about these social aspects particularly, because I think when we've all reflected on the framework, it is this transition of not just looking at indoor environmental quality and the occupiers, but looking at all people from community level to people in the supply chain and the construction workers. And that topic specifically of people in the supply chain, construction workers and people involved at end of life is really getting a lot of attention. And Andrew, I wonder if you could maybe shed some light on why it's so important for this sector in particular to consider all the people in the supply chain.
Well, I think the construction industry is one of the best examples of community, not only through collaboration of manager design and construction, but also obviously the end use of space. And those communities are really important. You can see over time, anywhere in the world where you've started to develop and had a significant development process, the way people interact. And from my point of view, from the end of the supply chain, it's always very difficult to ensure that the brief across the kind of activity, even from government and legislation, is within the mind of those communities. Of course, we're not just talking about person to person, we're talking about groups and the way that we engage. And the framework does a very good job of laying out how those different segments, such as education and commercial, all work well together and integrate. We've always driven very much the side of being into the detail of the specification or the brief that we need to require to deliver, whether you're a contractor or a designer or a manufacturer. And I genuinely think now that the levels of detail within our processes and within the amount of energy or people or material ingredients that you use within a product are now going to become extraordinarily important. No longer are we going to say, are we making a green choice or are we specifying a green process? We should be considering much further the real ingredients, like you would check on a back of a packet within your supermarket on what you're putting into your body. And certainly the work that I've done more recently with ChemSec, which are really to eradicate chemicals out of products, have tried to dictate how across all industries we can have a direct correlation between managing the kind of like the difficult materials in every process or every product and eradicate them out. So it's not, I'm talking from a product manufacturer point of view, but if you're a contractor or a designer, it's exactly the same challenge. I just have definitive ingredients within a given finished product that I can work with or change over a series of time. And ultimately they all contribute to having that effect of building the people, the relationships, and ultimately the communities that the construction industry has to deliver on. And unfortunately, when you get to that detail in whatever process or role that you work within, you only really ever find out after quite a long period of time whether or not that's been successful or not. And that's one of the reasons why we have to start sooner rather than later at all these different stages, because we won't really know until we've really put it into play for a long time.
Andrew, thank you. And I think you've left us with interesting food for thought for a lot of the attendees of this webinar, whatever type of actor you are in the value chain. And what you said reminded me of something that I actually read on the news this morning, so incredibly timely. I'm not sure if any of you would have seen it, but a study that a UK research group did and published today showed that 230 companies who were sampled, of them, only half of them were able to prove that there weren't human rights violations in their supply chain. So of the 200 and something companies that were surveyed, 100 of them had no idea, and a third of them weren't even hitting basic due diligence marks. So I think that that level of ignorance, if we continue attracting attention to it, hopefully is something that will be a thing of the past in the few years, or at least a trend to improving. But we also now need to hear from our wonderful audience. We've got a few minutes left, and we have a poll set up that we want to hear our audience's thoughts on. Ghazi Mohammed, could you launch our poll, please? Thank you. So, as you can see on screen, which of the principles for health do you see as a priority for Africa? We're being very mean. You're only allowed to pick one. Indoor environmental quality, that's covering air quality, water quality, comfort indicators, harmony with nature, that's our biophilia, our nature-based solutions, biodiversity, healthy behavior indoors and outdoors, our behavior choices and activity levels, and social connectivity, social value, as we were just talking about across the supply chain, and climate action, which we'll try and unpick a bit more in the next few minutes. Okay, thank you. Mohammed Ghazi, could you take the poll down now and share the results with us, please? Very interesting. So we can see that most of our attendees have voted for positive social value, but then indoor environmental quality has ranked quite highly as well. Maybe that's because of the relevance of the moment with the pandemic. Beatrice, would you mind sharing your thoughts and reactions to this poll?
Actually, if I was to pick one, I'd probably have also picked the creative positive social value. It feels like it encompasses the other aspects of it, because then you're looking at how I would describe value. Then I'll have to look at health somewhere in there. Of course, your biophilic aspects, indoor environmental quality, climate action, of course, and being also very cognizant of what that means when we look at our context in Africa. I'd be pretty interested in terms of what the audience or the rest of the panelists would define as positive social value, because then for me, it captures, again, that word, holistic view of having different aspects of the different pillars and actually the different aspect topic heads that you'd actually highlighted in the framework. So I'm aligned with this one. I would have picked positive social value, and of course, maybe because of bias, healthy behavior would have been second for me. Back to you, Katrina.
Thanks, Beatrice. Do any of our other panelists want to come in with reflections on this?
I would quickly come in and say that I sort of understand where Beatrice is coming from, and understand that indeed to create value for people, they will need to actually benefit from all of these other issues that have been voted on. I think, like I mentioned earlier, all of these are interconnected in one way or the other, right? To serve both human health, but also the health of the planet and the health of society. So if we're working to create buildings and a built environment that supports healthy lifestyles and has good access to indoor air quality, but also outdoor air quality, access to water and sanitation, and all of these things that will help us live a healthier lifestyle, then ultimately we will be in a position where we can say, there's a cascading of effects that ultimately leads to positive social value.
Thanks, Michael. And unfortunately, we are running out of time. We have just 2 minutes left. So I'm sorry we've not been able to get to more of the great questions that have come in, but I do want to give our panelists the opportunity to leave us with their one closing remark, their soundbite for the session, their 1 or 2 sentences that we're going to remember later this afternoon as we're drinking our cups of tea. What is the takeaway for the audience, please? Georgina, can I come to you for your closing remark, please?
Yes, you can, Katrina. I think health and the environment are very similar from the perspective that we really only have one shot at both of them to get them right. And so once we degrade past a certain point, there's really no return, and there are going to be severe consequences. So the thinking around preserving and nourishing both, our health and the environment are both premised on the type of thinking that we need to take us forward. And that's really long-term thinking. It's holistic thinking. It's very balanced. And I think that we know that failure to act on climate change is going to have severe risks. They've really been identified as the top risks in several kind of financial reviews and reports, and they're going to impact marginalized and less able communities that can respond to those kind of risks. So this is a priority, and I think that if we view it from the lens of green buildings, which are typically healthy buildings as well, they position organizations, clients, people to respond to both the needs of and the challenges of today and of the future. So I think, to close, focus on health and well-being really does inspire a built environment in which both people and planet can thrive. And this really does provide a framework and the starting point to consider all of the key considerations to take this forward. Thank you.
Thank you. Nice uplifting words. Michael, your 1 or 2 closing sentences, please.
Right. I think for me, I'll actually pick on a point that Andrew was making earlier about, how impact that it will have. So my key message or my closing remarks for this session is really around the issue of radical collaboration. And I mentioned radical because what we need is radical transformation of our current systems. So I think, yes, radical collaboration between the key stakeholders along the full value chain and life cycle of the built environment need to take ownership and concrete actions to deliver the healthy spaces of the future that we so desire.
Thank you. Great words. Not just collaboration, but radical collaboration. Beatrice, your closing remarks, please. Quickly, please. Thank you.
Yeah. And then for me, the closing remarks again, reiterate what Philip's CEO mentioned. And I think it's the idea of how can we leverage innovation, whether it's with corporates like Philips or with organizations like yours, or just entrepreneurs in the market, and just strengthening this entire call of just living our lives and even doing our business, whatever kind of business that we do responsibly and sustainably, and getting to see how we promote health while we are doing that. So I look at it from a medical doctor's perspective. It's really a balance and harmony. You need healthy people. We need to be healthy for us to be able to do the things that we aspire to do, to achieve the goals that we want to achieve. But then we also need to have a healthy environment or be part of a healthy planet for our health to also thrive. So in that sense, by taking care of the kind of buildings that we have, and also the planet as well, and just your entire social responsibility, so to speak, is also investing in your health. So it's just looking at it as a balance and needing to see how we strengthen that balance, whether it's through innovative processes and of course engaging with stakeholders and different partners around the table to achieve that.
Thanks, Beatrice. And Andrew, bring us home. Closing remarks, please.
I'm just going to be very brief, and I'm just going to say, look, we see documents like this and frameworks like this from various sources. If you're watching this webinar today, take just 1 or 2 of these different parts of this structure, challenge your team or your employees, and integrate it into whatever discipline you're employed to do within our industry. And there's, in one way or the other, I love radical collaboration. Through radical collaboration, we will ultimately get there, but we have to be intentional in doing that. So please take something from this. Don't just read it and say that was good and put it to one side. actually challenge the people internally within your businesses or in your next Zoom call, and let's make it happen.
That's a great takeaway, Andrew. Thank you. Georgina, Michael, Andrew, Beatrice, thank you very much. It's been a pleasure to have you on this panel. Thank you for your insightful words. And Ancellor, back to you.
Thank you very much, Katrina and the rest of the panel. That was indeed an insightful conversation. Wow, so many insightful takeaway points that I got there. I think one of the last ones is very interesting. It was talking about being intentional with this radical collaboration. See, now I've got new words, new terms in my dictionary now that I think are big in the space for us to make sure that we take away. And another thing that I liked during this panel discussion was that one of the speakers said we have to have an interconnected crisis rather, and not only a health or climate crisis. So that's very interesting. Everything we do is interconnected. So we need to play our role in ensuring that we build better buildings, and then we create positive social value. Like 50% of the people on the poll said they want a positive social value. So now we are going to our last session for this event today, and it will be led by Vere Shaba. Vere, can take it away.
There's no sound, Very.
Vera, please just unmute. We can't hear you. Are we able to assist Vera? She is still on mute. While we fix Vera's sound, can we have the panelists come on board and they can introduce themselves so long? Thank you. Elizabeth, you can go first.
Thank you very much. Thanks for having me here this afternoon. My name is Elizabeth Wangeshi Shege. I'm the chairperson of the Kenya Green Building Society. I'm also the vice chairperson of the Africa Regional Network of the World Green Building Council. Thank you. Over to you, Roger.
Hi, everyone. I'm happy to be with you here today. My name is Mwanta Roger Tikum from Cameroon. I head the Cameroon Green Building Council as the CEO. I think today will be a great day. Thank you.
Thank you. Nkosinati.
Hi, everyone. Privilege and an honor to be here with you today. I'm Nkosinati Manzana. I serve as a non-executive director on the Green Building Council of South Africa and the board of the World Green Building Council. Very privileged to be here. Thank you.
Thank you so much. And Amira.
Hello, everyone. I am so honored to be here with you today. I am presenting Egypt Green Building Council. I am Amira Ayoub. I am an architect, a sustainability consultant, USGBC lead, and WELL faculty.
Thank you so much. Vera, do we have sound yet?
Would this be working? Can you all hear me?
Yes, we can. Thank you.
Okay, great. Thank you very much. And it's such an honor to be here. I think it's been such a great session. if we look at the last 2 sessions that have happened, I almost wish that this could last a little bit longer and that we could all be in the same room and we could all really discuss and unpack this tool even more. I feel that with session 1, we really heard the word holistic, which was quite interesting to look at the poll results, because when you look at the poll results for Africa, and a lot of people saying they place a lot of value on social value, that was interesting because in Asia Pacific, it was a different priority, which goes to show that regionally, it's so important that we actually zone in on what we feel is important to the African continent in order to move the green building movement forward. And also to really emphasize healthy buildings. So we have a great group of panelists today, and what's lovely about our panelists is that they're from across the continent. So we've got from Southern Africa, from East Africa, West Africa, North Africa. And so what we will do for this particular session is we want to show the practical examples of what it looks like to actually apply the health and well-being framework principles within your buildings and within your projects in your countries. And if you have any questions, please put the questions into the questions box, because we'd love to hear that. And this is the whole point of this, is for it to be interactive. And also just you can put your comments in the chat. So what we'll do now is Nkosinathi will just start us off by positioning this tool. So where does this health and well-being framework tool actually fit into all of the different tools that are available? And then from there, Elizabeth will speak a little bit more about case studies from East Africa. Roger will speak around case studies from West Africa, and Amir will speak around case studies for North Africa. So they'll speak right after each other. And once all of that is done, then we will go straight into questions. So yeah, if Nkosinathi, you could please start, and then the rest of the panelists will just remove our video as well. Nkosinathi is presenting. Thank you all.
Thank you, Vera. Is someone going to bring up the slides, please?
Next slide, please.
Thank you. Thank you very much. Once again, very privileged to be here. So as Vera says, I thought what I should do is just give my own sense of the location of the health and being framework that we are launching today. And located within existing tool sets without really getting into the detail of any rating tool. Look at tool sets and also just position it from the perspective of the strategy of the World Green Building Council. I apologize upfront if I do repeat things that were said in previous sessions, which unfortunately I couldn't join. But I think as a starting point, we all are really familiar with the challenge and dare I say the opportunity of the built environment. We are familiar that by 2050, the projection is 9.8 billion people in the universe. 70% of those will be in urban environments. This population explosion, as it were, will result in the doubling of floor areas and up to a 50% increase in global energy demands. More importantly, and this is where the opportunity fits in, is that we've come to know that buildings are responsible for close to 40% of global carbon emissions and 50% of global material use. And as it stands now, 91% of people globally live in environments where pollution levels exceed the recommendations of the WHO. Next slide, please. So from a World Green Building Council strategy perspective, I caught the tail end of the last session, and I was quite pleased to see that there was some discussions around the SDGs. So the ambitions of the World Green Building Council are quite aligned with the 17 SDGs on 3 levels. The advanced goals are those areas where there is a significant, where the built environment sector has to act upon. It's directly linked to what we do. The progressive goals is where there is a significant impact, and the growth targets are where possibly there isn't a strong link, but there is a connection in relation to what we can contribute as a sector. And I think you see right at the top of that slide, the SDG on good health and well-being takes pride of place in terms of the overall World Green Building Council strategy. Next slide, please. And so from a, can we roll over to the next slide? Sorry, yeah. And so from a strategy perspective within the World Green Building Council and the movement in general, 4 reasons of focus and driving this implementation and transformation. The goals have been organized around 3 impact areas: climate action, health and well-being, resources, and circularity. In the last part of the last session that I joined, once again, the connection to these 4 impact areas did come up. And I would hope that everybody that's online is quite well aware that the North Star goals for the building and construction sector along these impact areas have been defined earlier in the year. The 2020 baseline is also known and defined, and so have been the milestone performance globally for 2030 and 2050. So we all have a clarity of vision on what the challenge and the ask is. Next slide, please. And so what I thought I would do is just give a view around existing tool sets. And I use that in generic terms. As I said, I'm not going to get into certification tools, any specific certification tools. The health and well-being framework is exactly that. It's a framework. I do think it's got significant potential to be developed into a global tool, which is applicable across the value chain of buildings and the construction sector. It sits right at the nexus of best practice scientific medical research overlaid with property expertise. Going in respect of making a general sense of the existing rating tools as we know them, my personal sense is that they focus quite a bit on the environmental performance of buildings. And for the last couple of years, the big push by practitioners and people in this movement has been to extend the thinking really beyond just the building envelope to precinct neighborhood scale. And we're quite well aware in South Africa, for instance, there's a little bit over a handful of projects that have been certified at that scale. Globally, the number is bigger. The International Wellbeing Institute came out with this WELL standard in 2014, which in my view, currently, before the launch of this tool, would have been probably the most comprehensive take on buildings and green buildings and how they contribute to wellness, with a specific focus on occupant health and comfort. They do complement existing rating tools, mainly because of the focus on the occupant. I would say mainly focused on the operational stage of the building. In South Africa, for instance, there's one building that I'm aware of that's been accredited to the WELL standard, and globally, a little over 300 projects. What the World Green Building Council Health and Wellness Framework does, in my personal view, is kind of pull it all together. So if you look at the tool sets that are available from a rating perspective, and you overlay that with tool sets that focus specifically on occupant well-being and comfort, this framework for me pulls it all together. It gives a firm basis for focusing on socioeconomic and environmental determinants of health for all people, and not just occupants, and dare I say for society at large. And that's really the beauty of it. Next slide, please. And so in the last session, you would have gone through, I'm guessing, to some detail based on the benefit of the last 15 minutes that I was able to join you. You would have gone through some detail on the 6 principles. And I guess my parting shot here is that I've already said I see good complementary aspects of this well-being framework with existing tools. I also see good alignment with the WELL standard, which in itself focuses on things like air, water, nourishment, light, comfort, and mind. And I think you can pick the words that it may use slightly different words in terms of this framework compared to the WELL standard, but I think you can see that there is strong alignment. But the beauty of all of this for me is that it starts to bring in social value and connectivity, almost moving away from the selfish notion of people thriving at the expense of the planet. And I think more specifically for Africa, and as evidenced by the previous session where the attendees voted on which of these 6 principles is the most important, it brings in the aspect of social value. I think it's a framework that is quite ripe for development into a global rating tool. It has a lot of utility as an advocacy tool, education tool, and for designers to start thinking about the holistic view of our buildings, the social impacts right from the design stage. Thank you, Very. Back to you.
Guys, thank you very much. Thank you very much, Nati, for really like setting the framework in that perspective. We'll be handing over to Elizabeth now, who's now going to look at it from the perspective of how do we apply some of these principles? Because it's exactly what Nati had mentioned in terms of that it's very holistic. It covers all the different aspects, and then it all comes together within this framework and the 6 principles. So over to you, Elizabeth. All right, so Elizabeth is currently
I'm back.
Oh, there you are back. Okay, there was a little bit of electricity and Wi-Fi problems, but back to Elizabeth. Another reason why we need to get off the grid. So back to you, Elizabeth. We'll see if that works. And if that doesn't work, then we'll just hand over to Roger if it's still frozen.
Okay, no worries at all. And yes, I might need the assistance of moving the slides as well, as much as I wanted to drive this health and well-being framework. But as we say, we're very tenacious in Africa, and we can definitely get around it. So we've seen the health and well-being framework mentioned, the image there. So my case studies today, I've just picked a couple, and they go into the sub-principles. And it's also to show the amount of detail that the health and well-being framework has available. On to the next slide, please. So here we have an extract. It's actually from the book of abstracts from the Kenya Pediatric Association. And the title of it is Laminated Chipboard as a Wall Cushioning Improves Thermal Comfort in Newborn Resuscitation Room. Results of a prototype experiment at Awendo Sub-County Hospital in Migori County. So this is looking at Western Kenya. I mean, the title of the abstract definitely speaks to the medical fraternity, and I really like what Nkonsi had earlier, that the health and well-being framework gives us a platform of communication across to the medical and the scientists, as well as the property sector. So some of the extract on this specifically is that a quality improvement experiment was done at the sub-county hospital due to high energy needs and high hypothermia rates of newborn. The risk of all-cause neonatal mortality increases by 28% for every 1 degree centigrade drop in body temperature below 36 degrees. Good thing to remember. Another thing they note as well is that design and material choice in construction have a great impact on room temperatures. And this is where we normally have been coming into the discussion. Walls and floors made of ceramic tiles are likely to have lower temperatures compared to wood or PVC materials. So the source of that study is actually there, and the authors are the Kenya Medical Research Institute, Industrial, University of California, San Francisco. To the next slide, please. A bit more about this sub-county hospital. And if you note, we've moved away from looking at commercial buildings because our health and well-being framework is for all buildings and for everyone across the world. So for Kenya here, this particular one, frequent power outages, like the one I just experienced, room design flaws were determined to be the root causes of challenging high energy needs. Then the solution there that's put in the abstract is that cushioning with laminated chipboard was proposed. So the results themselves, I took consultants to actually take some studies in the space, and they had the baseline temperatures where they saw that after 5 o'clock, as expected, we are close to the equator, as the map there shows. The temperatures would drop below the 25 degrees centigrade, which was the adaptive thermal comfort that was optimum for this particular clinic and for the neonatal newborns. Then after the first intervention, which was looking at the wall of the building, which was covered in ceramic tiles for ease of cleaning. So sanitation at that point came first. But at the same time, the rate of this fatalities is so high that Migori County is one of the highest and Kenya is one of the highest in Africa. The temperature difference in cushioning the wall and considering that thermal comfort dropped to the 25 degrees, below 25 degrees would drop after 9 p.m. So buying in an extra 4 hours. Then third level with energy efficient lighting and looking at the equipment that was being used, and also even considering natural ventilation and renewable energy, temperature drops were after below 25 degrees was after 11:30 p.m. So quite simply, the health and well-being framework has thermal comfort as one of the sub-principles, and as well as climate change or climate action has been mentioned in there. So directly, we can pull examples like this, and not just in the urban areas, also in the rural areas. Next slide, please. So final slide here just shows Nairobi City, coming back to the urban area, and this is the commercial sector of the city. Although we have a deficit of affordable housing, one of the things that we're definitely looking at is using the health and well-being framework to look at those socioeconomic factors that have been brought up. And one of the actions that's going across the country is planting trees. And I thought this note here from the framework is quite useful. A tree is a natural air conditioner. The evaporation from a single tree can produce the cooling effect of 10 room-size residential air conditioners operating 20 hours a day. Tree windbreaks can reduce residential heat costs 10 to 15%, while shading and evaporative cooling from trees can cut residential air conditioning costs by 20 to 50%. Next slide, please. And with that, I hope it answers why us from the green building councils in the region, we are also planting trees, and the consideration of using the health and well-being framework to communicate with the medical industry. Thank you very much.
Thank you very much for that, Elizabeth. And thank you, exactly like what you said, it's actually not only limited to commercial buildings. And I think that that's something that normally comes up when it comes to green buildings. It actually is across all different kind of building types for all people everywhere. So sustainable buildings for everyone everywhere. Our next speaker is Roger, Sonwantja Roger Tikum, and he's from the Green Building Council of Cameroon. And so what he will do is he will share a few more case studies of how the health and well-being framework has actually been applied within Francophone West and Central Africa, but also Anglophone West Africa. So just a few case studies to show how that has been applied. Thank you, Roger.
Thank you very much, Vera. As I said earlier, today is a great day for Africa and Africans. The launch of the health and well-being framework is a turning point for the African built environment in particular and the world at large. It is generally said that charity begins at home. I'm from Cameroon, and we'll obviously start by showcasing the certified green building in Cameroon that was designed, constructed, and now operating with all the 6 principles of a healthy and sustainable built environment. Welcome to the Douala Grand Mall. It is said that this mall, I mean, the promoters and everybody who goes around, is one of the biggest, is the biggest even in West and Central Africa. The Douala Grand Mall is a shopping center with 18,000 meters square of rental space. It will include a multiplex of 5 cinemas with 1,000 seats, a supermarket, 160 stores and boutiques, 22 restaurants, a spa, 640 parking spaces in the first phase. The second phase, which is the business park, will have a 5-star hotel and offices. It is an EDGE certified green building. Yeah, I think we should go to the previous slide, please. Now we have the 6 principles of health and well-being, which are what all of you have heard already. When you look at the picture to your left, I don't know if you're seeing it to your left of your screen, you see that that building is in harmony with nature. You see shrubs, flowers, and grass have been introduced, and they will eventually attract insects, birds, other small animals, giving the feeling of a natural environment to occupants and visitors, thus ameliorating physical and mental health. You see the one to the right, the image you have on the right, there you see that comfort has been prioritized. So we have prioritized comfort there. We have sealed semi-transparent glazing that serves for natural lighting, low penetration of external noise, good human vision while in the interior of the building. Next slide, please. Now on this particular slide, we equally have 2 images. We have the one to the left, which is showing how action has been taken. I mean, to mitigate on climate change, to mitigate climate change. You see, the Douala Grand Mall is built with materials of very low embodied carbon and well implanted in its environment, thus making it resilient to climate change. The projected savings of EDGE certification are 29% for energy, 51% for water, and 50% for materials. All these green characteristics go a long way to promote health and well-being. To the right, we have another image, which is there. You see people talking amongst themselves. That particular image is indicating that there at the Douala Mall, the Douala Grand Mall, healthy behavior is facilitated. That is equally one of the principles of our health and well-being framework. There you see we facilitate positive behavior and health by creating spaces for humans, connectivity. This works perfectly for mental health. So you see people talking there amongst themselves and they can obviously exchange a lot of things. Next slide, please. Now on this slide, we equally have 2 images. One shows clearly, I mean the one to the left shows how health can be protected. You find wash hand basins equipped with tap heads and liquid soap ejectors that function automatically with sensors to avoid touching hands spreading infectious diseases. The indoor air quality of the mall is good because of the well-structured ventilation system. To the right, you will see how social value is created. Social value, you see 2 people moving along together talking. So you see the Douala Grand Mall creates and promotes social value through interaction amongst colleagues from different backgrounds, different communities, and different regions, thus enhancing mental health. Physical health is safeguarded by the provision of personal protective equipment to workers with the aim of limiting corporal damages in case of accidents. Next slide, please. Okay, the next slide, we have other case studies. We will not talk only of Cameroon. You see, I had to go into Nigeria, which is neighbor to Cameroon anyway. It's found in West Africa. There you have Blue Water Lagos, which is a mixed-use residential facility in the Lekki Phase 1 area of Lagos in Nigeria. It is endowed with thermal performance glass, energy efficient lighting and cooling systems for energy use reduction, and low flow faucets and dual flush water closets for water consumption reduction. This directly touches climate action, which is one of our principles of the health and well-being framework, and thus health and well-being of occupants. When it touches climate action, it means the health and well-being of occupants is equally touched. So, and positively anyway, it is basically designed and constructed with all the 6 principles of the health and well-being framework. Consider it is equally an EDGE certified green building. Next slide, please. I think we're running out of time. In the next slide, we have the Cosmos Mall, which is at Yopougon, that is found in Côte d'Ivoire. Cosmos Yopougon is the first world-class shopping center to be built in Yopougon in Abidjan, in Abidjan's largest municipality in Côte d'Ivoire. The shopping mall provides a convenient and high-quality shopping experience to a previously ignored lower middle-class community of almost 2 million people. Opened in October 2018, Cosmos Yopougon is anchored by Carrefour, Burger King, and the largest Majestic Cinema in Côte d'Ivoire. It is basically designed and constructed with all the 6 principles of the health and well-being framework considered. It is equally an EDGE certified green building. Next slide, please. Now you see by 2030, you heard when Consinati was talking about the North Star goals. By 2030, all new buildings, infrastructure, and renovations will have at least 40% less embodied carbon, with significant upfront carbon reduction, and all new buildings are net zero operational carbon. All the 6 principles of the health and well-being framework will be integrated in the development of these portfolios. Next slide, please. Thank you very much. It was a pleasure talking to you all. Thank you. Thank you again, Vera.
Right. Thank you very much, Roger. Thank you for that. Having a look at case studies, if you've just joined us, having a look at case studies from across Africa that have actually been using some of these principles. And after the last presentation, just to look at the case studies, which is Amira, and she's going to speak a little bit more around case studies in Egypt. We're going to go into some of the questions that we have received, and also just a reminder of what the 6 principles are, and also just a note that this is the beginning of this conversation. This is not going to end here. And so the whole heart of this is really for you to see some of the case studies and from here to answer some of the questions that we can. But know that next year we will be doing some webinar series where we will deep dive into some of these topics. So this is just an introductory level. So over to you, Amira.
Thank you very so much. Hello everyone, I'm so happy to be with you today. I will be presenting Egypt Green Building Council and sharing a case study from North Africa, from Egypt. So next slide please. Next slide please. Our case study is EPIC Complex. EPIC is located at the new administrative capital of Egypt. It consists of commercial, administrative, and medical unit. It is 20,000 meters square. The project is the first registered Fitwel building in Africa. Next slide, please. And for those who are not familiar with the Fitwel certification, Fitwel is the world's leading certification committed to building health for all. Next. And it is operated by the Center for Active Design. And next, please. As you all know, that the definition of the World Health Organization to the World Health, it is the state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. And according to Fitwel, it has 7 health impact categories, and they are mainly focusing on occupants' health and well-being. Next. And this was so much aligned with the project concept, where the heart of the project concept is occupants' health and well-being, so people could actively feel a positive difference on their health and productivity. Next, please. I will share with you some strategies that were implemented in the project to enhance occupants' health and well-being. Next slide. In the integration of the daylight and the views in order to have natural light inside the spaces and integrate circadian rhythm was considered, and also having air system. Next slide, please, where they are monitored to produce more filtered and refreshed air. And at the same time, in order to prevent dirt and particles from entering the building, there will be entryway systems. Next slide, please. And also a smoke-free policy where smoking will be prohibited from the indoor and outdoor spaces at the same time. Very, can I have control for the slides? Can I? Okay. Also, there will be policies for the healthy food inside the building, where to encourage people to have access to healthy food, and at the same time there will be a fresh healthy food market to encourage occupants to have accessibility to more healthy food. And one of my favorite parts of the project is the fruit and vegetable garden at the outdoor plaza, where it will be accessible for all regular occupants, so they can enjoy harvesting and gardening at the outdoor. At the same time, taking care of nurturing mothers and their baby was also considered. There will be lactation rooms located at different parts of the building, and also the design of the stairs to encourage occupants to be more physically active. It will be located in a visible area, and at the same time it has a panoramic view, as you can see here, to encourage occupants to take the stair rather than go and search for the elevators. Also, there will be a walking trail on the roof and indoor fitness facilities. This will also encourage occupants to be more physically active. Creating an outdoor plaza where people can enjoy the outdoor air and at the same time be connected to nature and have connectivity with the community and the social and the consideration for the social aspect is also created here, because as we all know that when people are more connected to nature and outdoor, their well-being will be much more enhanced. I believe that the strategies used in this project are so much aligned with the World Health and Wellbeing Framework. And when we actually think about this project, we really wish it will be a beacon to raise the awareness about the Health and Wellbeing Framework, and really wish it will make a market shift here. And we ask ourselves if this will be a call to action, this will have a major effect on people's health and well-being. Thank you, everyone.
Okay, thank you very much. So at this point, I'd love to invite all of our panelists to put their videos back on. Thank you, Amira. And just to remind everyone what these 6 principles are that we've officially now launched as the Africa Regional Network. The 6 principles are: protect health, prioritize comfort, harmony with nature, facilitate healthy behavior, create social value, and take climate action. And so some of the projects that you've seen have used all of these different principles, and we really just have positioned to show how this framework works. And so we only have a few minutes. As I predicted, it's always one of those sessions that you just wanted to carry on and to really understand it better. But to answer some of the questions, I'll just pose a question to our panelists. I'll start with you, Elizabeth. So just in terms of the health and well-being framework, what are some of the challenges that you think people feel like they might face, and how have you been able to just, or how can people overcome these challenges and actually applying the health and well-being framework? Because that's something that we've seen can happen, and so it's just really understanding how can one overcome some of these challenges of applying the framework.
I think the first thing is people have to read. People have to educate themselves, and people have to use this health and well-being framework. The same approach with green buildings, rating tools, the information is out there. We have all the technology we need, especially in Africa. We have the youth, we have the skills to actually do more than what we're doing. So the first step is get into education and showing the links between the health and well-being framework. What's being strategized in the framework is not new. It's not something that's from somewhere else. It's things that we're seeing in buildings already, and in the rural areas, we're already doing that. I also wanted to mention, for example, Konza Technopolis, that's doing a lot with wastewater management. So it's a matter of putting all and consolidating all the information and working together towards a common goal. Thank you.
Exactly, and I think that kind of leads into the question that I have for you, Roger. So when we're looking at creating social value, which was actually one of the priorities that, you know, the people who are attending put in their polls, how would you say one can actually get that market transformation? So in terms of applying this health and well-being framework, just from your experience as part of the Cameroon GBC, how were you able to go from people not knowing what a green or healthy building is to suddenly being able to know and understand that a healthy building and a green building is actually for them as well?
Okay, thank you for the question, Vera. You know, the first thing is advocacy. You know, we have very many ways of talking to people. As Elizabeth rightly said, you know, education is the base of everything. So we need to go to people, we need to go to policymakers for them to understand. We need to go to educational institutions. We need to go to the public. We need to tell them what they need to hear and what they need to know about the health and about their health and well-being. Because first of all, it's for oneself. It's not as if it's something that they're doing for somebody else. You're doing it for yourself. So you just need to put that into them, and then I think they will start understanding that this thing is it's good to introduce them in their construction works and buildings. Thank you.
I think that speaks into what you said about just in terms of making sure that we understand that buildings are created for people in mind. And a lot of the times I think Nati mentioned this earlier, we look at environmental performance, but we don't actually look at all the other aspects. And I think if I bring this question to you then, Amira, obviously within the context of North Africa, where it's incredibly hot, incredibly dry, you know, the climate and the environment, it probably speaks into some of the principles of prioritizing comfort, protecting health, and almost facilitating healthy behavior and harmony with nature. How would you say consultants can actually apply this kind of framework for their clients? So if they're building a building now, even if it's an old existing buildings, how would you say one can actually practically do that within the different climates?
That's very important question, Very. I believe that first of all, we need to have demand for healthy buildings. We need to raise awareness for everyone to start thinking about healthy buildings as something that should be applied everywhere. And when we have this, consultants should work collaboratively to come up with new ideas, to think of ways of how to, as you said, have thermal comfort while at the same time having strategies for improving the indoor air quality and saving energy. So I believe that it's a matter of an integrative process where everyone should all work together to come up with new ideas. I believe that this is a key concept.
Yeah, it's really bad that we don't have enough time, but we've tried to squash all the questions in together. And I think it's exactly what you said, and maybe that's almost how we'll almost end it before I go to Nati's, the last question that I'll ask Nati. And I think it's about collaboration. And I think something like this is one of the ways that we're doing this, where we're able to reach across the continent and speak about these topics and really unpack them, look at case studies. And I think that that's definitely a way that we can continue to see this framework applied. And so just the last question that I have for you, Nati, and I'm already over time, and I know my team is going to speak to me about all of these things. But just in terms of the question that we received is, how do we address, and this is the principle of taking climate action. And the question that was asked is, how do we address the gaps between knowledge and what goes on in homes, in SMEs, on the street? So how do we get the man on the street who knows nothing about this webinar? How do we get them, and how do we actually bridge this gap? So almost like closing remarks in that sense for everyone who's been a part of this entire session. Thank you for being here. Thank you for sticking it out with us. And so just like, how do we get the man in the street to be a part of this important conversation?
Yeah, very thanks for the question. I do think that one of the biggest things that this framework does for us in terms of moving us forward is that same concept of social connectivity and social inclusion, which creates those collision points for information to be shared, for knowledge to be transferred. So if for instance, I'll give you one example. If your building is designed with a setback from the street edge, with a open piazza that's planted, as Elizabeth was demonstrating, that is open to the public, it does create that collision point for people to spurring the question, why did they do that? It's open to all of us to use. It's a social amenity, and the conversation starts. The social inclusion in respect of looking at the health of construction workers in a structured way creates a new conversation that leads on to the bigger discussion around the framework. It would have been lovely to have time, I think, to explore a lot of examples, but I think it's simply just assimilating this and understanding what it's calling on us to change and creating those collision points and conversations to move it forward.
Okay, thank you very much to our panelists for session 1, session 2, and for session 3. And if we look at the health and well-being framework, this was a multi-year global consultation process that happened. There were expertise across the built environment, health, human rights, and that actually came down to these 6 principles. And again, the 6 principles are to protect health, to prioritize comfort, harmony with nature, facilitate healthy behavior, create social value, and to take climate action. And with 2020 being a very fundamental year when it comes to climate action across the world, I think it's so important that Africa continues to have a voice in this discourse and continues to really apply it contextually to our continent. There are 54 countries on this continent. Within the countries, there are different contexts within even its own country. And really for every single one of us in this room to constantly think about these principles and see how we can best apply it. You know, like how Nati was saying, to really allow the public to be a part of the space and to come into these kind of conversations. So I know we don't have enough time, and so I'll hand over to Ancilla. But thank you very much to our panelists, and we really, really look forward to having more of these kind of conversations going into 2021. So thank you to every single one of you, and thank you to our attendees. Over to you, Ancilla. Thank you.
Wow, thank you so very much, Vera, and your panel. That was indeed an insightful conversation, and thank you for the case studies that you provided us with today so that we can be able to better understand what's already being done and try and figure out where we fit in this whole space and what we can do in our respective places. I know that there's a couple of questions due to time that we're not able to answer. Please feel free to email africa@worldgbc.org. Email africa@worldgbc.org if you've got any questions, or you're coming from a country that doesn't have a council, or you just want to get involved and do more stuff. We really hope that we're going to receive a lot of those type of questions and emails so that we can keep the conversation going. Let's make sure that we also continue talking via social media using the hashtag Better Places for People. Thank you so very much, everyone. Thank you to the World Green Building Council and everyone who's here today. And thank you for caring about the environment, our climate. And before we go, just one read through of the 6 principles, because we need to have them engraved in our minds. It is protect health, prioritize comfort, harmony with nature, facilitate healthy behavior, create social value, and take climate action. With that said, have a great afternoon. Thank you.